Like and subscribe and click the bell icon to get new video updates.
Ambulance Victoria calls code red as call-out system crashes. Victoria's beleaguered ambulance system was again forced to call a code red overnight, because of extreme demand for services and a dispatch system breakdown. Ambulance Victoria called a code red shortly before 1 a.m. on Friday that lasted for just over an hour. The code red was called shortly before 1 a.m. and lasted for just over an hour. Patients in metropolitan Melbourne were told not to call for an ambulance unless it was an emergency. Ambulance Victoria's Executive Director of Operational Communications Lindsay Mackay said a confluence of factors led to the code red being called. "We had some technical difficulties at times around the computer-aided dispatch system," Ms Mackay said. "We also had increasing numbers attending hospital, we had workload and demand pressures, and just everything came at the same time, which just pushes the system that little bit further." Ms Mackay said while the code red did mean an escalation, it did not signify a critical emergency. "We're not saying that everything is at crisis or that everything is falling over," she said. "It's just that the system is a little bit more overloaded, and at that point we really just want to pull additional levers to see how we can try ease the system." Victorian Ambulance Union Secretary Danny Hill said there were about 70 pending call-outs at the time the system collapsed. "Read more, they literally need to go back to a manual card system. So, it is very difficult to be able to detect which crew might be nearest to a case, who can actually get to go to a case quickest," he said. "They rely on the crews actually having to manually call in and say this is our location, this is where we are. So, it is very inefficient and it does lead to delays." Mr Hill said unnecessary calls to Ambulance Victoria contributed to the system being overwhelmed. "Some of the cases that have come through overnight are people being sent to cases where the patient wasn't even home. They were sent to that case, lights and sirens, because the patient needed to get up to hospital and they were driving back to their house to meet the ambulance crew. It is just such an inefficient and inappropriate use of ambulance resources." The overnight code red followed a report last month that showed about 1/3 of urgent Code 1 ambulance patients waited more than the target time during the March quarter. The number of call-outs surged during the same period, at a time when record numbers of paramedics were furloughed after being exposed to COVID-19. Ambulance Victoria responded to 93,234 Code 1 incidents between January and March, a 14.2% increase on a year earlier. Code 1 cases represent urgent lights and sirens emergencies. Ambulance Victoria Acting Chief Executive Libby Murphy said the surge made the 3-month period the busiest in Ambulance Victoria's history. Paramedics responded to 66.8% of those calls within the 15-minute target set by the state. Elderly man waited 2 hours for help. Joseph Gatt, 96, was one of many Victorians left waiting for help after he had a fall while trying to get out of bed on Thursday just before midnight. His daughter Carmen Uren called an ambulance over fears her father had badly hurt himself at his Port Melbourne home. Mr Gatt then started to experience symptoms of a heart attack, sweating and shaking on the floor. When help arrived 2 hours later, 2 ambulances arrived at their home when they only needed one. Mr Gatt's son-in-law Chris Uren said the entire experience had left his wife traumatised and in tears. "They were already stressed out as it was, and the longer the ambulance took, the worse it was getting for them," he said. Mr Uren said it didn't help that his father-in-law experienced regular periods of confusion in his old age. "The fact that he has to wait on the floor for 2 hours for treatment is certainly distressing for him and the family," he said. "They were not professionals. They were relying on professionals to help them and it didn't happen." The BlackRock man said it was sad, and just wrong that the system wasn't prepared to meet high demand. "These sorts of things should not be happening," he said. "They should be well and truly tested under pressure conditions to ensure that the glitches in the system are ironed out before they are critically needed. Issues not a quick fix, Minister says Victorian Tourism and Sport Minister Martin Pakula defended his government this morning, and said it was doing everything in its power to support the state's strained health system. Victoria's embattled 000 service will be renamed and its board disbanded as part of a state government overhaul, amid blown-out waiting times for critically ill patients and staff shortages. Read more. He said ongoing staff shortages, topped by a pretty significant